Have you ever noticed how a tiny toothache seems to throw your whole day off balance? One little twinge, and suddenly you're not enjoying your coffee, your soup, or even your smile. And if you're over 70, like many of my patients, you might be wondering, is this just part of getting older? Or can I do something about it? Let me tell you right now, age doesn't have to mean losing your teeth or putting up with constant dental issues. In fact, some of the healthiest mouths I've ever seen belong to people in their 70s, 80s, even 90s. And it's not because they're lucky. It's because they paid attention, just like you are right now. Today, we're going to talk about 4 of the most common dental problems people face after 70, and more. Importantly, how you can avoid them. We're going to walk through this step by step in a way that's simple, practical, and doable. No fancy terms, no guilt, no lectures. Just real-life solutions for real people who want to keep enjoying their smile and their lives. Now, before we jump in, I want to say this. If you're watching this and you're dealing with tooth pain, dry mouth, loose dentures, bleeding gums, or even if you just feel like your mouth isn't quite right anymore, drop a comment below. Tell me what you're facing. This is a safe space. I read the comments, and I'd love to offer advice or even just point you in the right direction. You're not alone in this. Let's start with the first major issue, and this one sneaks up on people more than they realize. Gum disease. Now, I know that phrase might sound a little dramatic. Gum disease, but it's far more common than most folks realize. In fact, according to the CDC, nearly 70% of adults over the age of 65 have some form of gum disease. That's a lot. And here's the kicker. Most people don't even feel it coming. It often starts quietly. Maybe your gums bleed a little when you brush, or they feel tender or a bit puffy. You might notice your teeth looking a little longer, not because they're growing, but because your gums are pulling back. That's your body's quiet way of waving a red flag. And I know when your joints ache or your energy is low, brushing and flossing might not be the first thing on your mind. But here's the truth. Healthy gums are the foundation for everything else in your mouth. If your gums are in trouble, your teeth don't stand a chance. You could be brushing every day, but if the gums are receding, bacteria are sneaking in and setting up camp deep beneath the surface. Over time, that leads to infections, tooth loss, even bone damage. So what can you do? Start by being gentle but consistent. Use a soft bristle toothbrush. Hard bristles do more harm than good. Make sure to brush the gum line, not just the teeth. And floss, even if it's just once a day. If regular flossing is tough, try floss picks or water flossers. They're easier to grip and less painful on the hands. And don't wait until something hurts. Get your teeth cleaned professionally every 6 months. Yes, even if you wear dentures or have implants. You'd be surprised how much that can help you stay ahead of problems before they start. Now, let's talk about something that most people never bring up until it becomes unbearable. Dry mouth. Sounds simple, doesn't it? A little dryness, no big deal. But for older adults, dry mouth is one of the biggest culprits behind tooth decay, gum problems, even infections. And here's why. Your saliva isn't just there to keep things moist. It's your body's natural defense system. It washes away bacteria, balances acids, and protects the enamel on your teeth. But as we age, our saliva production naturally slows down. Add in medications, blood pressure pills, antidepressants, allergy meds, and dozens of others, and that dryness can become a daily frustration. You may notice a sticky feeling in your mouth, cracked lips, trouble swallowing, even a persistent sore throat. And when your mouth is dry all the time, it becomes the perfect place for bacteria to thrive. That's when decay ramps up. That's when cavities sneak in, even in people who've never had them before. The good news: there's a lot you can do. First, water. And I don't mean just sipping occasionally. I'm talking about making it a habit. Keep a bottle nearby. Take small sips throughout the day. It sounds basic, but staying hydrated can work wonders. Second, check your medications. Don't stop taking anything, of course, but talk to your doctor or pharmacist. They might be able to adjust the dose, switch you to something that causes less dryness, or recommend something to help. And third, use products designed for dry mouth. There are rinses, sprays, even lozenges that stimulate your natural saliva. These aren't gimmicks, they're actually helpful. I've had patients come back after a few weeks and say, "Doc, I forgot what normal used to feel like. Until now." One more tip. Stay away from mouthwashes with alcohol. They dry your mouth out even more. Instead, choose alcohol-free versions or those specifically labeled for dry mouth. And if you smoke, whether it's cigarettes or cigars, now's a good time to think about quitting. Smoking is one of the fastest ways to worsen dry mouth and damage your gums. Now that we've tackled gum disease and dry mouth, we're already off to a great start. These two problems are the root cause of so many other dental issues in older adults. And the sooner we get ahead of them, the better off we'll be. Let's keep this momentum going. Because there's another issue that sneaks up on folks, not in how it feels, but in what it steals from your life. Now that we've touched on dry mouth and gum disease, let's talk about something that many folks over 70 deal with, but often don't bring up: worn down or cracked teeth. You might notice your teeth feeling more sensitive than they used to. Maybe you've bitten into something soft and still managed to feel that zing of pain. Or even chipped a tooth on toast that wasn't supposed to be that crunchy. These little signs, they're more than just annoyances, they're your teeth waving a flag for help. As we age, the enamel, the hard, protective outer layer of our teeth gets thinner. It's just like how our skin gets more delicate. Years of chewing, grinding, and even brushing with too much force can take their toll. And unfortunately, worn enamel doesn't grow back. Once it's gone, it's gone. That's why small cracks and chips become much more common and more dangerous after 70. You might think, well, it doesn't hurt that bad, I'll just ignore it. But here's the thing, even tiny cracks can let in bacteria. That can lead to deeper infections, root canals, or, worst case scenario, losing the tooth altogether. And you and I both know that dental work at this age can feel like more of an ordeal than it used to be physically, emotionally, and financially. So what can you do? First, try to avoid biting down on very hard foods. Nuts, hard candies, even some kinds of crusty bread can be tricky. Instead, opt for softer versions, roasted, but not raw nuts, and breads you can easily tear apart. Also, if you grind your teeth at night, which many people do without even knowing it, talk to your dentist about getting a custom mouth guard. It's a small investment that can protect what you've got left. And most importantly, don't skip those dental checkups even if your teeth feel fine. A lot of these cracks are invisible to the eye but can be caught early with x-rays or a thorough cleaning. Now, while we're on the subject of saving your teeth, let's look at a problem that can sneak up when you least expect it: poorly fitting dentures. For those of us who wear them, we often think once they're made and fitted, that's it, they're good forever. But our mouths change as we age. The shape of our jawbone, the thickness of our gums, even how we chew, all of these things can shift, slowly but surely. If you've ever found yourself adjusting your dentures more often, or if you've noticed sore spots in your mouth, clicking sounds when you talk, or even trouble tasting your food, your dentures may be due for an adjustment or a complete refitting. I can't tell you how many of my patients over the years thought they just had to put up with it. But you don't. You deserve to eat, speak, and smile with confidence and comfort every single day. Ill-fitting dentures don't just cause discomfort, they can also lead to sores and infections in the soft tissue of the mouth. In some cases, they can even change the shape of your face over time, making you look older than you are. That alone is a good reason to have them checked regularly, isn't it? And here's something most people don't realize: the way we chew our food has a direct impact on our digestion and nutrition. When dentures don't fit right, it becomes harder to chew thoroughly, which can lead to digestive problems like gas, bloating, or even constipation. So it's not just about your mouth, it's about your whole health. One simple tip: if you're experiencing issues, try eating in front of a mirror. Yes, I know it sounds a little odd, but watching how your mouth moves while you chew can help you spot if your dentures are slipping or not aligning properly. If something looks off or feels uncomfortable, it's time for a visit to your dentist or denturist. And please, if you're watching this and you've had any pain, discomfort, or even just questions about your dentures, leave a comment down below. Share your experience, your frustrations, your tips. You're not alone in this, and your story might just help someone else. Alright, we've made some great progress already. You're doing wonderfully just by being here, by taking the time to care for yourself in this way. Dental health isn't always fun to talk about, but it's one of the keys to maintaining your quality of life, your ability to eat your favorite foods, laugh without worry, and smile with pride. Let's keep this going, because next, we'll explore another common issue that doesn't get enough attention, but can make all the difference when it comes to protecting your health and independence. Tooth loss. Even just saying the words out loud can feel like admitting something's been taken away from you. And for many people over 70, it's a painful reality emotionally and physically. Losing a tooth isn't just about the gap it leaves in your smile. It changes how you chew, how you speak, even how you feel about showing your face in a photo. But here's something I want you to hear loud and clear. It is never too late to protect the teeth you still have. And even if you've already lost some, it is absolutely possible to preserve your health, comfort, and dignity going forward. Tooth loss often doesn't happen all at once. It creeps in slowly, first a small cavity that goes unnoticed, then maybe a tooth that starts to loosen, or one that breaks and is never replaced. And little by little, chewing becomes harder. Meals become more frustrating. Social outings feel more like a source of anxiety than joy. You start avoiding certain foods, maybe even avoiding conversations. I've seen it happen more times than I can count. And it breaks my heart every time because it doesn't have to be that way. The good news is modern dentistry gives us a lot more tools than we used to have. Partial dentures, bridges, implants, these aren't luxuries anymore. They're options that can change someone's life. I once had a patient in her late 70s who hadn't smiled in over a decade. After we restored just 3 teeth and refitted a partial denture, her entire personality seemed to shift. She smiled wider. She laughed more. She even started dating again. And all of that joy started with taking care of her dental health. But let's say you still have most of your natural teeth. That's wonderful and absolutely worth protecting. That means making brushing and flossing a true daily ritual, not just a habit. Soft bristled toothbrushes are best, and gentle. Circular motions help prevent gum recession and enamel wear. And don't forget to floss. Yes, I know it can feel tedious, especially with shaky hands or tight spaces between teeth, but there are great tools now. Floss picks, water flossers, and brushes specially made for seniors with arthritis or limited mobility. These things make a difference. And I'll say it again because it's so important. Regular dental checkups are your best line of defense. Even if you have no pain, no bleeding, and no obvious problems, a dentist can catch issues you can't see or feel yet before they become emergencies. It's like checking your car before a long road trip. You might not notice anything wrong right now, but wouldn't you rather fix a small leak than break down in the middle of nowhere? Another thing I want to mention, because this often gets overlooked, is the link between tooth loss and brain health. You may have heard of studies connecting oral health to cognitive decline, and the science is becoming more and more clear. When you lose teeth and don't replace them, the brain can actually lose stimulation in the areas that control chewing and speech. Over time, this may impact memory and even increase the risk of dementia. I don't say this to scare you, I say it because your mouth is not separate from the rest of your body. It's all connected. Every choice you make, even something as simple as taking 5 extra minutes to clean your teeth well at night, adds up. And I know, sometimes dental care feels expensive. Sometimes appointments feel intimidating. But there are solutions, and there is help. Many communities offer senior dental clinics, mobile dentistry services, or sliding scale payment plans. You are never too old to ask questions, to get answers, or to take care of yourself. If there's something you're struggling with, whether it's affording care, finding a good dentist, or simply building the courage to schedule that appointment, drop a comment below. Say what's on your mind. I promise you are not alone. And I'll do my best to reply, offer some guidance, or point you toward resources that can help. You've made it this far in the video, and that already tells me something important about you. You care. You care about your health, about your future, about living well, not just longer, but better. And that matters. A healthy smile is more than just teeth. It's confidence. It's nourishment. It's conversation. It's connection. It's your power. So let me leave you with this. Don't wait for a big problem to show up before you take action. Every day is a chance to protect the smile you've worked a lifetime to build. Whether you have all your teeth, just a few, or wear full dentures, your oral health is still part of your story, and you get to choose how the next chapter goes. Stay strong, stay proactive, and remember, no matter your age, your smile still matters because you still matter. You know, I often say to my patients, especially the ones over 70, you've taken care of others your whole life. Isn't it time you gave that same care back to yourself? That includes your smile. Not because it needs to look perfect, not because you need to impress anyone, but because your smile is one of the most powerful ways you connect to the world. You've smiled through weddings, laughed through birthdays, maybe even gritted your teeth through tough times. Your teeth have been there for every bite of your favorite meal, every word you've spoken to someone you love. That's why they deserve just a little extra attention now, because they've served you so well. I want to leave you today with a simple truth. The most important step to protecting your smile isn't some expensive treatment or fancy product. It's simply being aware, being consistent, and being kind to yourself. That's it. Daily care, just brushing gently twice a day, flossing or using a water flosser, keeping your mouth moist if you struggle with dryness, and seeing a dental professional at least once or twice a year can prevent so many of the problems we talked about. And when you do those small things regularly, the payoff is huge. You feel more confident. You enjoy your meals more. You lower your risk of infections and even reduce your risk of heart issues or memory problems. Yes, it's all connected. I know people tend to think, I'm too old for this to matter. But let me tell you something I've learned from over 30 years of treating people in their 70s, 80s, even 90s. The ones who keep showing up for themselves, even in small ways, often live happier, healthier lives. And when I say show up for yourself, that also means listening to what your body and your mouth is trying to tell you. Are your gums bleeding when you brush? Does your breath feel stale even after cleaning your mouth? Do your teeth feel loose or sensitive? These aren't just annoyances, they're signals. And when we listen early, we can act early. You don't need to wait for pain to take action. I know it can feel overwhelming at times. Maybe you've been putting off that cleaning for years. Maybe you're embarrassed because your dentures don't fit right, or you haven't been able to chew certain foods. Let me reassure you, there is no shame in where you are right now. What matters is where you go from here. You deserve care that makes you feel safe and respected. And you deserve to enjoy the simple pleasures in life, like biting into an apple, or smiling freely in a photo with your grandkids. And no, it's not too late. It's never too late. If you've made it this far into the video, you've already taken the first step. That means you're someone who's ready to take action, who wants to keep living with vitality, with dignity, with joy. And I'm honored to be part of that journey with you. So here's what I'd love for you to do next. Take a moment and share in the comments. What's one dental challenge you're facing right now? Maybe you're dealing with dry mouth, or worried about a loose tooth, or struggling with getting to the dentist. Share it. I promise, your comment might help someone else feel less alone. And if you're comfortable, I'll try to offer tips and guidance directly in the replies. And if you found something helpful in this video, even just one piece of advice, you're going to try, go ahead and hit that like button. It helps more people find this kind of practical, compassionate health information. And if you'd like more videos on staying healthy and feeling your best at every stage of life, don't forget to subscribe to the channel. We're building a community here, one where age is not a limitation, but a badge of wisdom and strength. So here's to you, to your smile, to your health, and to your beautiful future. You've still got so much to give, so many stories to tell, and so many reasons to smile. Let's keep that smile healthy, strong, and full of life for all the years to come. Take care of yourself, and I'll see you in the next video.